So good afternoon, everyone, and good morning to those joining us from the West Coast. My name is Hamera Osman, and on behalf of Muscular Dystrophy Canada, I am very happy to welcome you to our first webinar from our new Let's Talk NMD, Let's Talk Neuromuscular Disorders series. Before I introduce today's topic, I would like to mention a few items. As you may have seen in the press, a number of Zoom webinars have had security breaches recently that led to images being shared. We have done our very best to reduce our risk of this by limiting audience members from sharing their screens and sharing and speaking during the webinar. However, if you see or receive any derogatory messages or images during this webinar, please advise us immediately by raising your hand as you did at the beginning of the session or using the live chat feature. I would also like to add that we have a lot of time at the end of today's webinar for a live Q&A. At that time point, you can use that hand raise button and we will invite you to share your experiences, comments, or ask questions of our speakers. I'd also like to note a recording of today's webinar will be available by the end of this week on our MDC YouTube channel. Throughout today's webinar, if you have any questions or comments as they come up, please type them in that chat box. With that said, let's get started. Today's weekly webinar is on caregivers, and as many of you know, in Canada, the first Tuesday of April has been adopted by the Members of Parliament of Canada to recognize the importance of caregivers. Interchangeably known as National Caregiver Day, this day marks the recognition of caregivers and the valuable contributions they make to care recipients and to our neuromuscular community. At Muscular Dystrophy Canada, we proudly represent individuals with over 160 different types of neuromuscular disorders. And while we aim to provide disorder-specific information, what we have heard in the last few weeks from our clients over and over since the COVID-19 pandemic has been declared is that caregivers are of concern and of importance. We have heard from individuals with spinal muscular atrophy, Duchenne muscular dystrophy, myotonic, hereditary motor sensory neuropathy, giant axonal neuropathy, all asking about how do I protect myself and my caregivers during this crisis, not only from the virus, but also from fatigue, from burnout, while practicing social isolation and physical distancing. So in terms of caregivers, they were family members, friends, personal care attendants, personal support workers, home care aides, and nurses. We are also hearing that due to COVID-19, many family caregivers that were traditionally relied upon for emotional support and basic assistance are now expected to perform medical and nursing tasks that are increasingly complex. This includes managing medications, performing wound care, and operating durable medical equipment like ventilators or oxygen therapy. Understanding that caregivers is a topic of interest for individuals with neuromuscular disorders and their families, we chose to host this webinar, and we are very grateful for our fantastic lineup of speakers. In advance of their presentations, I would like to take a moment to thank each of our speakers for their time and expertise. I would also like to thank Barbara Stead-Coyle and our executive leadership team here at MDC for supporting this initiative. And with that, I'd like to pass it over to our CEO, Barbara Stead-Coyle.
Thank you so much, Hamera, and welcome everyone. This is a very important topic, and while we always had plans to move a lot of our expertise and knowledge translation online, COVID has meant that we've done it probably in a more expedited manner. So thank you all who are joining today. As you can imagine, a lot of work has gone into today's presentation, and I'm so grateful to all of the presenters who are going to speak today. We are clearly in a new place and a new time where we're trying to define a new normal for not only our community, but the entire world population. And so I'm so grateful that we've been able to move very quickly onto an online platform to deliver important messages from each and every one of our community. We have an Ask the Expert line that you can also access, and we will continue to rely on you to provide us with what topics are meaningful and important to you. This is a series that we do see continuing with every week. And so we want to hear from you, our community, on what you would like to hear about and learn more about. And I'm so very grateful to the team of MDC who moved very quickly to pull this webinar series together. And I just have to give a little shout out to Ken KRAMER, because Ken, I haven't seen you in person for a while, but I'm so happy to see you are participating again today. So thank you. And without further ado, I hand it over back to Hamira to lead the panel.
Thank you very much, Barbara. So now we have Dr. Jill Cameron. Dr. Cameron is an associate professor and vice chair of research in the Department of Occupational Science and Occupational Therapy and Rehabilitation Sciences at the Faculty of Medicine at U of T, University of Toronto. She's also an affiliate scientist at TRI, the Toronto Rehabilitation Institute. Dr. Cameron's primary research interest is to understand the experiences and needs of family members who assume the role of informal caregiver for individuals with disability. I'm going to go ahead and stop sharing so Dr. Cameron can upload her slides at this time.
All right. So thank you so much for inviting me today to share some of my thoughts and some of my research that I've conducted over the last little while on the topic of family caregiving in this really unprecedented time of COVID-19. All right, so my slides aren't advancing. Any thoughts? Not sure what's going on. I guess we didn't practice the slide.
If you'd like, Dr. Cameron, what I can do is I can upload it. It might take a moment, but I'm seeing a chat come in.
Oh wait, there it goes.
Okay, there we go.
Okay, so I don't know what happened differently. Okay, so I just want to give you a little bit of my background. So I've really been doing research in the area of family caregiving for over 20 years. Overall, my goal is to understand the impact providing care has on caregivers' health and well-being. I want to understand their experiences and their needs for support. I then like to think about what changes we could make to our healthcare delivery system that would better support family caregivers. And I really have been doing research in a variety of different populations, but my goal really is to understand a lot of the common aspects of caregiving across illnesses. So we can provide a more general recommendations and suggestions when possible, still while recognizing some of the nuances in some of the different populations. So this is a lot of the work that I've been doing. I always like to start with a slide like this that really helps people remember, and this audience obviously knows, but I always like people to remember why it is that we should be caring about caregivers. And I was reminded recently of this wonderful quotation by Rosalind Carter, who said, there are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need a caregiver. In Canada, we know that 1 in 4 Canadians are often providing care in the community to somebody who isn't fully able to care for themselves. Janet Fast and her colleagues at West have been able to estimate that the unpaid labor provided by family caregivers annually saves our healthcare system about $60 billion a year. In the US, that number is about $450 billion a year. So the family caregivers really contribute to the sustainability of our healthcare system. Without them, our system would be in big trouble. We also know across illness populations that family caregivers can experience stress, burden, poor mental health, quality of life, disrupted lives, works, et cetera, et cetera. There's many different ways that caregiving can affect the caregiver, and this can ultimately impact patient outcomes as well. So that's just really a quick slide to sort of provide some context. So caregiving during COVID-19, it's really unprecedented. I did a quick search of the literature just to see what types of research have been conducted in situations where social isolation and social distancing was the norm. And really, there's no literature that has examined this in any kind of detail. We often hear from family caregivers that caregiving can be socially isolating. So what happens when the whole population is practicing social isolation? How does that affect the caregiver? So we think about the different care environments where people may receive care. We have the home here. This is not a Toronto home. I'm not sure where this is. We have an acute care hospital here, a rehabilitation facility here, and then a longer term care facility here. I think one thing that COVID-19 has done has really made these different environments very isolated and distinct from each other in many ways, but also people who are within these different environments are isolated from others who are outside. So if you have a family member who's in a hospital, for example, you may not be able to go in and visit them. So it's very isolating from that perspective. Now, all of my research to date has really tried to emphasize the fact that family caregivers need support for them to be able to continue in and optimize their role as a family caregiver. So what I like to do is I like to highlight the different dimensions of support. Of course, there's the emotional element, which is very important. Caregivers also receive information from a variety of different sources. They may receive tangible assistance where somebody is providing hands and also need to receive training. So work may have traditionally been provided by a healthcare professional, and they may need training to be able to undertake these different activities. Another important thing that the support literature brings to us is this idea of appraisal. And I often hear from caregivers who are in a caregiving role say that they really wish that somebody could give them some feedback about how they're managing in their caregiving role, such that they could make changes to improve their role, or they could feel confident, more confident in the care that they're providing. So whenever I talk about caregivers needing support, I really want us to remember that there are so many different dimensions, and it's important to consider all of them. Then like to think about, there's many different sources of support out there for family caregivers. In previous research, I presented this as if it were a support buffet. So if somebody were to go up to a buffet table at a restaurant or a party or something like that, they would choose supports that they prefer and that are more of interest to them and to satisfy their appetite. So just to think about it, we have healthcare professionals, we have friends and family members, we have neighbors. The caregiver themselves is a source of support. There are peers, other people in the caregiving role. There's all sorts of resources available online or in books. And then there's also the telephone is another way that caregivers can obtain different types of support. So I think, you know, currently we really need to think about how to optimize the use of these different types of support to make sure caregivers continue to be supported in the context of COVID-19. So I realize we have a number of different panelists, so I really wanted to kind of cut to the chase. And I want to make sure everybody has a chance to be heard and share their perspectives and experiences. So this is my final slide. And, you know, when people come up to me and they understand the research that I do, they say, you know, we have a family member in this situation. What kind of advice would you give to them? And so what I've really done is tried to pull together some of that advice, and I'll share that with you here on my final slide. One thing that I think it's important, especially in the context of social isolation, is to remember that other people are happy and willing to provide support in many different situations. And these might include friends, family members, neighbors, peers, other, you know, sources. And so I highly recommend things like family meetings where you can discuss as a group what sorts of assistance needs to be provided, and then start to identify who can provide different types of supports. So maybe it would be hugely beneficial from a caregiver's perspective to have somebody go and do their grocery shopping for them. There doesn't need to be any social contact because somebody could theoretically just come to your house and leave your groceries for you. And that might be a huge source of support for a family member, for a caregiver. Of course, healthcare professionals are a very important source of support, but things are a bit different now. You know, we're hearing from caregivers that they're concerned about having any home visits from, you know, some of their regular supports. And so the question might be, well, maybe you should speak with the organization that usually provides supports for you and ask them about their safety protocols. So if you know that there will be somebody coming into your house, that you will be more confident that you won't be placed at risk to catch this very contagious illness. There's also, you know, I see a number of situations where healthcare professionals are starting to use more online sources to provide care and support as needed. So telehealth is definitely emerging as a way to meet the needs of people of all situations. And I think that should also be available for family caregivers. Of course, online, there's many different organizations. It's important to go and check out their websites for information. And it's better to start with reputable organizations because there's all sorts of other information out there. And then also from the caregiver's perspective, I think it's vitally important for you to remember that it's okay for you to take care of yourself. And I often, when speaking with caregivers, realize that they've put their own health and well-being sort of aside as they're focusing on the care of somebody else. And I think it's important for you to remember that you should always be taking care of yourself. And it's really okay for you to do that. It's really going to help you be healthy and safe in your own caregiving role, which again, as we've said earlier, has implications for the person you're caring with as well. So I will stop there and allow our next presenter to take over.
Great. Thank you very much, Dr. Cameron. Next, I'd like to invite Rebecca RACKOW. Rebecca is the Director of Advocacy, Research and Public Policy Development at the Canadian Mental Health Association, the Saskatchewan Division. Rebecca, if you'd like at this time point, you can go ahead and share your slides. Rebecca received a BA Honors in Psychology, and she's a registered social worker with a strong interest in collaborative research. For over 20 years, she has worked as a caregiver with seniors, youth in care, children in a daycare setting, and provided respite for foster parents. Rebecca developed a mental wellness program for caregivers through the Canadian Mental Health Association called Caregiver Affected Recovery Education. Welcome, Rebecca.
Hello, am I unmuted now?
Yes, go ahead, Rebecca.
Okay, thank you very much, Amira. And thank you for that introduction. Essentially, yes, I came to the Canadian Mental Health Association, Sask Division, with some really keen interest in finding out how to protect caregiver mental wellness. As Dr. Cameron was saying, caregivers are in a unique situation where they end up struggling with mental health issues occasionally, unique to caregivers. So I'm going to talk a little bit about that. That's my slide. So first of all, I'd like to define caregiver as one who takes care of the needs of another who requires help. So essentially, that's the definition that is used when we look at a fairly commonality of issues that can come up when you're caregiving, right? So this can be someone who does this as a profession, like a senior caregiver, youth care worker, daycare worker, social worker, teacher, nurse, therapist, pastor. There's many others as well, but just to get you kind of thinking of who is a caregiver. This can also be a family member or a parent or a child or a sibling or a neighbor or a close friend or a coworker or a peer supporter. And there's many other people who are also caregivers in a maybe a less formal but a very pertinent way. So the threats to mental wellness that is common amongst all caregivers is vicarious trauma, compassion fatigue, burnout, post-traumatic stress disorder, PTSD, and addictions or addictive behaviors. And I'll just go through. Vicarious trauma is when you are exposed to a lot of other people's stories who are having difficulties, and it looks like the world looks like that. That must be the common experience of existence. And that changes your worldview to a very kind of a negative place. Compassion fatigue we'll talk about in further detail, and burnout we will as well. Post-traumatic stress disorder happens when you have your care recipient is either a violent person and you feel fear for your life, or in such a situation, a medical situation or something where their life is it's precarious for them, and you feel that by watching what's going on or by being a part of what's going on with that. Addictions and addictive behaviors is basically, I always call that self-care gone wrong. That's when your body knows you need self-care and chooses unhealthy ways of getting that. And there's also other things that happen with caregivers that can be difficult and can actually be stressors for those conditions, and that's codependent relationships. Sometimes dark humor kind of can be a relief, or it can be a pitfall. Toxic workplace culture for those who are professional caregivers, difficult family relationships for those who are family or friend caregivers, being able to have crucial conversations with others, grief, snake oil, that's people trying to tell you there's a cure for whatever ails your care recipient, and it's desired so much that you can put yourself in financial burden for that. Trauma and distance are some of those things. So what you want to do as a caregiver is build up some resiliency to those issues that come up. And some of the things that really help is some physical health or wellness things that you can do, making sure you get enough exercise, making sure you're eating right, positive self-talk. And again, when Dr. Cameron said you yourself are a support for your caregiving, just looking in the mirror and saying, I'm doing this right, I'm doing okay. This is, I'm a good person. I try my hardest. I'm doing good for my care recipient. Just reminding yourself of that is an important thing. Mindfulness, and that's just being present in the moment, and self-care is the big thing for me, is ensuring that you're taking care of yourself. That's basically like when in the airplanes they say put your own mask on before you help others. That's basically the idea. You have to take care of yourself before you can take care of others. So then I have, this is my slide on compassion fatigue, basically. So usually I do this with a live group of people. So I'm going to ask you all to imagine that you have a pitcher of lemonade. And I have my lemonade right here, my imaginary lemonade, right? And I have 10 people whose cups I need to fill, but my pitcher really is a 8-cup pitcher. So I start out giving all that lemonade to filling up the cups, but when I get to the last few, I'm rationing it, and those cups don't get as full of lemonade. It's just, I just simply don't have enough, right? That is like compassion fatigue. With compassion fatigue, you have a limited supply. Imagine you have a compassion container. Some people imagine it's their heart. Some people imagine it's, a little bottle inside you, a little pitcher of lemonade, right? You make the ability to distribute compassion, but you can run out if you don't make enough, or if you don't have time to make more. So you have like a limited amount that you can give at a time. So I have here kind of a description of compassion fatigue, and that's the cost of caring for others. Is that the problem becomes you end up losing the ability to empathize with them. So it's like you end up being kind of colder, or you don't feel their needs as easily. So I have a little test. You can all do this in your from where you are in your minds. A little test to see if you have compassion fatigue, but it's just for fun, actually. But just think about what the implications are, right? So if a 3-year-old family member comes to you with a drawing done at preschool, which sounds most like the response in your head. A, I'm so proud. I remember when she was a squirmy mess, you couldn't even eat by herself. Now she's drawing and in preschool. Good for her. That would indicate that you don't have compassion fatigue. If your response is, oh man, not another piece of junk I have to look at and pretend to like, I wonder how long I'll have to keep it before I can throw it away, then likely you are no longer being able to empathize with that person, right? Another example is if, you know, everyone experiences a reasonable amount of road rage. You're on your way to work and someone cuts you off without signaling, which sounds most like the response in your head. Nah. He's probably in a hurry. I hope he doesn't cause an accident driving like that. That's probably not compassion fatigue. That's a perfectly healthy response. But if you're holding on to it all the way to work and then proceed to tell all your coworkers, oh my gosh, that guy, he cut me off today. He could have killed me, you know, and you're hanging on to it for a long time. It's just sits there, doesn't leave. That is more of an indication of compassion fatigue. So these are just examples of things in your life that could just give you a signal that, oh, hey, you know what, maybe I need to be taking care of myself a little better. The other thing that I'm going to talk a little bit about is burnout. And that's that exhaustion of doing kind of the same things over and over. And it looks like disinterest. It feels like, oh my goodness, I have to do this again. And it feels like sort of resentment to the care recipient, or like everything just seems harder and you're tired of it and you're tired. And usually, if it's a professional caregiver and they're experiencing burnout, the best way to stop that is by changing jobs. But essentially, as a family caregiver, that's not really an option. So you have to look at other things that to do in that stead. Basically, like changing jobs, you have to change up your routine. Maybe do something that comes off as a little bit more challenging to do with your care recipient that would be satisfying, that would say, hey, I did that, you know, and you can change things up for yourself a little bit. So stuff my coworker with burnout says. Here's some of the things that I've actually heard. Everything I put in here that's a quote or something is usually is straight from other caregivers that I interviewed to make up my workbook. So congratulate me. I came into work today without purposely driving my car off a cliff to avoid it. Or they can't make me come into work tomorrow. Or I can't take holidays. How would this place run without me? Or they're introducing this new therapy, but it won't work anyways. I'm not going to do it. Or I'm going to the bathroom. Call me when my shift's over. These are actual things. But seriously, the way it presents then is disinterest or feeling the burden of the work, right? So again, these are some of those difficulties that I've mentioned before. I'm just going to go through that and skip straight to how to make lemonade. Or the 5 rules of self-care. And I'm just going to read them out, but then I will describe a little bit of how to change this up for a time when we're self-isolating and COVID-19 stuff. So number 1, get a clean whisk. That is, leave your care recipient out of the self-care. That doesn't count if you're thinking about your care recipient the whole time. Find the best lemons, or keep it reasonably healthy. Squeeze lemons just like grandma used to. This should also, self-care should help you remember who you are beyond the care recipient caregiver relationship. Make sure you use a pitcher that doesn't have chips or dents. That's keep it psychologically safe. And then shake, stir, and sweeten to taste. Let's focus on the fun of your self-care. So essentially, you know, a lot of people use outside things as self-care, like like going out and doing something with friends. That's not something that we can do these days. So essentially, one of the things I would like to share with you is something I share with a lot of caregivers who tell me they can't leave, they don't have an opportunity to leave their care recipient alone, is to reframe things as self-care. So if you're cooking a meal, it's not just cooking a meal, it's like having fun with it. Try to, you know, shake it up a little and add something different and have, you know, enjoy the moment of cooking, be a part of that. And or if your care recipient is sleeping, you know, take that time to read or to paint or to do something that fills your soul. So we just want to fill up that pitcher of compassion so that it doesn't run out, because then that makes the act of caregiving a lot more difficult. So that's all I have for that. So thank you all very much.
Thank you so much, Rebecca. I'm going to go ahead and share my screen now as I have the slides for Ken KRAMER. So next we have Ken KRAMER. Ken KRAMER is the founder and principal of KMK Law, a law firm in downtown Vancouver, BC. He provides specialized legal services in the areas of estates, trust administration, elder law, and estate litigation and mediation for the past 25 years. Ken has a unique understanding of the neuromuscular community as an adult living with spinal muscular atrophy, and he is extremely passionate and a strong advocate for home care supports. Ken is also a past chair of Muscular Dystrophy Canada. Welcome, Ken.
Thank you, Hamira and Barbara, for inviting me, and it's great to be back in the MDC community, and obviously during difficult times for all of us. Hamira has asked me to speak a little bit about sort of the actual practical day-to-day challenges that many of us in the neuromuscular community face on a daily basis. And maybe what I'll do is I'll start with a little bit of a perspective first in terms of my current situation. So like many of us throughout the country, throughout the world for that matter, we're self-isolating. I have a wife and a young daughter who's 14, and so managing all the issues that many of us are facing with young children in terms of homeschooling. And what we have is obviously one additional sort of factor, and that is I require basically 24 hours, 7 days a week home support. And I've been very fortunate in British Columbia, whereby I have an individualized funding program that enables me to effectively take responsibility for retaining, training, and managing my caregivers. And so I'm very fortunate that I have several very committed, long-standing caregivers. And I think when this crisis entered our community in the last month, I don't think that any of us really had a plan. But I do believe that, you know, people in the disability community are fairly resonant and are able to adjust. I mean, that's what we do on a daily basis. We adjust to bumps along the road. And COVID-19 is, in our world, another bump that encourages us to adjust and to ensure that we are taking steps to provide not only a certainty that we're in a safe environment, but the people around us as well, whether that's your family or whether that's your caregivers. And so I think the pandemic has created this need to adjust sort of on the fly. I think there's a lot of uncertainty still in the community, but I think the one sort of emanating concern for people in the neuromuscular community that is that we have this higher susceptibility and the fears that one might face if one of us was affected. And I think there's that element of a heightened state of urgency to take control. So in my situation, a couple of things that I've personally done is really take some real strategic steps with caregivers. And some of these steps were not unknown to me in that we were already practicing to some extent some of this, these practices. So, number one, having discussions with my caregivers about the pandemic and taking strategic steps with each of them to be able to ensure that we were all sort of practicing safe and healthy sort of practices. And so in my situation, I have two caregivers that are continuing to work for me. One of them is actually now a live-in and is living in the home with me and is there to provide supports. And it's very fortunate that, she's a non-resident student and was able to sort of adjust her schedule to be able to live in the home. And that's provided some real peace of mind for my wife and my daughter and I, and that, we have somebody that's isolated with us, an extension of our family that is in the home. And I have another caregiver who lives quite close to where we live, who also is, practicing very safe standards. I do have other caregivers that have multiple jobs. And we have all collectively agreed that it is in all of our best interest to sort of segregate and not sort of rely on those caregivers because of the fear that they may come into contact with another individual or in the community, whether through transit, etc., that might create more challenges for me. And that was a really big concern for me as well, because I don't want those individuals to be financially impacted either. But I found that through good dialogue with those individuals, there was obviously clarity that we were going to all need to make some decisions and some sacrifices. And I'll get to that point a little bit later when I talk about some of the advocacy work that I've been doing in British Columbia. Some general sort of practices that I've really found really helpful is, we have Purell throughout the house at different areas of the home, and hand washing is obviously a really important thing. Whenever there's any contact with me, the caregivers are, very clear that there's a need to sort of always take on that hand washing. There's also, friendly reminders. So I'm very much alive to it. I also, have some respiratory issues. I utilize BiPAP at night, and so having, that certainty of sort of avoiding these risks is really, really important. The other thing I also encourage, of course, is, when you come into the home, having assurances that, you've showered, you've got clean clothes, and that you're ready for that shift. We're also very cleanly in the home as well, in terms of just ensuring that, work surfaces, and especially areas where I'm more frequently in the home, that those objects are cleaned on a regular basis. We have actually not utilized masks in our home, more so because we think that we've sort of been able to, through self-isolation, really sort of minimize the exposure because of the caregivers that I have, being one living in the home again and one very close by, that there is not that sort of ultimate risk. And I'm not wearing a face mask as well. I find that the masks can be very challenging in terms of breathing for me as well. I've also really sort of had good discussions with caregivers, that, they're very honest with me and open. And if there was any sort of identified symptoms, whether it was fever, cough, or just generally unwellness, I encourage them, and they know because they've been with me for such a long period of time, the value of communication, of keeping me up to date on their health, and that they undertake steps to, ensure that, if they are not well, that it's best that they not be in that environment. So sort of getting onto some of the advocacy work that I've been exploring, I've been fairly active over the past 15 or so years with our individualized funding program in British Columbia, and have had lots of success with our Ministry of Health in terms of advocating for others. And I think one of the big things for me here is that I'm a great advocate for myself, but I also know that there are many people in the community that may not have that ability to advocate, may not understand how to adapt. And so I've really emphasized the need to sort of provide that support for those individuals, but also I'm thinking about the caregivers, and what can we do to make those individuals' lives better. And I alluded earlier to the issue of, caregiver that was not working. And one of my big concerns was that, that to some extent, this was my choice to not have them working with me. But I felt that it was really unfair that they were not being compensated. So it was really important to see for me that I was able to also financially compensate these individuals for what they've done for me as well. And so one of the things that I've been involved in over the last few weeks, and I think many of us in the neuromuscular community, we're always advocates, and COVID-19 is just another issue to advocate about. And so what I've been able to do over the last few weeks is through some fairly significant high-level negotiations with the province of British Columbia, we've been able to initiate some modifications on a temporary basis to our individualized funding program. And so one of the big ones, of course, was this ability to fund our caregivers for up to 2 weeks for those individuals that were required to self-isolate. And so this was a really big one. In addition to that sort of funding, the ability to also have access to additional funds by the ministry should your budget not enable that. So that is a really, I think, a huge sort of testament to not only the government, but also the community sort of recognizing the value of these caregivers and ensuring that we are taking steps to provide some element of financial reward as well. The other area that we looked at as well was just the whole issue of being able to sort of institute sort of emergency staffing elements. And another modification to the policy was the ability to obtain or to access emergency staffing through agencies. So individuals like myself that are using a direct funding model and retaining their own caregivers, the ability to sort of utilize other agencies if you were at a point where you did not have caregivers that were able to come in to the home. The third item that you'll see on the list there was a big one for me as well, was the ability to retain and hire family members. So, there are some individuals in the community that have chosen or unfortunately been left in a position where they have no caregivers. And the only remedy at that point is family, whether it's a parent, a spouse, a relative, or a friend. And so we felt it was really important in British Columbia to have some flexibility as well on the topic of being able to hire a direct family member. This has always been a contentious issue, but the ministry understood as well that allowing someone to hire their spouse or father or mother for a temporary period of 3 months was a reasonable approach to the pandemic. And then the final area was really just utilizing funding a little bit more broadly to deal with precautions and safety around equipment, masks, hand cleansers, cleaning supplies, etc. So that was also, the sort of the 4 areas that were really touched upon. Now, there are areas that still remain outstanding. And one of the big ones, I think, for clients or people with disabilities in our community is this concern that we may one day be hospitalized. We may be infected with COVID-19. And the need for having family or caregivers with us in that environment. And that's something that we're continuing to sort of negotiate with both the Ministry of Health as well as our provincial health office to recognize that this is unique times and that every health agency, organization, hospital will have their own sort of discretionary rules around this. But I know this is an area that's very, very important for people with disabilities. That isolation in a hospital environment is probably one of the biggest fears that many of us have. And I will add that there's one other element, and many of these materials are going to be available subsequent by Hamira. But in Ontario, there's been a little development around a triage protocol with respect to the COVID pandemic that has drawn the concern of both the disability community as well as the seniors community in terms of prioritization in an area where there may be shortages of medical equipment, respirators, etc., and the concern that people with neuromuscular disorders may be in a delicate situation of not being eligible for certain medical supports. And I know that MDC has signed on to a letter to Premier Rob Ford about that triage protocol. We're of the mindset that many of the provinces throughout the country, including Canada or British Columbia, also have a similar triage protocol, but we'll make that available to everybody as well to read and share and learn. And obviously, in closing, I'll just pass along my best to everybody and encourage you to stay safe and healthy and continue to practice good practices in terms of cleanliness.
Thank you so much, Ken. And you actually brought up one of the questions that came in as a question, which was about the COVID-19 triage protocol in Ontario. So thank you very much for addressing that. Up next, we have Maria-Hélène Bolduc and Danielle Campo, who are Directors of Mission at Muscular Dystrophy Canada. Both Maria-Hélène and Danielle lead their work at MDC with MDC's values in mind to support people with neuromuscular disorders. Today, they'll be talking about system navigation. Keeping in mind the time, they're actually shortening their presentation, and then we'll turn it to the live Q&A. So go ahead, Maria-Hélène and Danielle.
So thank you, everybody. And as Hamira said, we are going to shorten our presentation, so we won't be proceeding through our slides, but it's important to pay attention to the screen as that outlines our system navigation program for you. What Marie-Helene, myself, and all of the service specialists within our mission team at MDC would like you to know is that we are always here for you. We're here at the other end of the phone for all of those caregivers that are listening, for any questions you may have. Our goals are to support you through these dynamic, different, challenging systems that we have in the non-medical model. So we encourage everybody to feel free at any time to pick up the phone and reach out. There's a service specialist across the country in your area that can help answer your dynamic needs. And we know, as we've experienced through COVID, that no two calls are the same, and we're here to provide that education, that advocacy, like I said, to help you navigate these complex systems. We are really excited that very soon we'll be launching our virtual networks for a chance to people to just get together in an informal setting over online virtually to just connect, as well as our website has amazing information always for you with the different resources. So in the speedness of making this happen quickly, and we know that there's only 5 minutes left for the Q&A, we know how important it is to hear your questions. We kind of fired through our program today, but again, I can't stress enough, we are here for you at the other end of the phone. So please feel free to reach out. Our numbers are all on our website, so reach out, connect with your service specialist, and let us help walk with you through these challenging times as well as through any time. So on behalf of Marie-Helene and myself and all of the service specialists that are on the call today, we do thank you for taking the time to come to this presentation, and we look forward to being here for the Q&A. Thank you so much.
Thank you so much, Danielle and Marie-Helene, for adjusting your presentation and for sharing about our system navigation program. Now we have time for the live Q&A. As a reminder, you can submit your questions in the live Q&A box or press the hand raise button, and I will unmute you should you want to use the mic to ask your question or to share your experiences. If there are no questions, we also did receive some questions by email that we can go through as well. So just wait to look for any hand raises. But I can also advance as you're thinking of your questions. We had a question come in about, we have personal care aides, personal support workers, home care aides that come into our home. What precautions should we take? Ken did a great job in talking about the precautions that he takes around the home. And we also have information on our social media channels, so on our Facebook in English and in French, on different precautions that you can take that are in line with the Public Health Agency of Canada. So a reminder about using hand sanitizer, using frequent hand washing that's thorough and well done, having a sign at your door that just makes sure that everyone understands if they have any symptoms and that there is someone at risk in the home, to be able to monitor for that, and as a reminder to be able to be practicing good hand hygiene. And this is also a resource that's available at the Public Health Agency of Canada. Should you have a member of your home contract COVID-19, there is advice available for how to address that as a caregiver. And so we'll share the slides with you as well. Another question that came in is, I have a clinic appointment, but the hospital has restricted any family members or visitors from entering the hospital. I have a personal care attendant. What should I do? And so in terms of this, what we have noticed is, yes, a lot of hospitals around the country are limiting or restricting people from coming into the hospital and restricting it only to the patient themselves. However, throughout the last week, they have been modifying their policies, and as we've called around hospitals and clinics, to allow essential personal care attendants to accompany them to their visits. So our advice would be to, prior to your appointment, go ahead and call the hospital or your clinic director or your clinical admin to let them know that you will be coming in with what is called an essential personal care attendant. And that could be a formal caregiver or a family member. Another question that came up is, are there caregiver groups specific to neuromuscular disorders? Danielle, would you like to speak to that?
Yes, thank you, Humira. So we have been aware that there are many wonderful resources on Facebook, and I know that I saw her on the call earlier, and I'm sure that Debbie Rayburn is still here. She runs an amazing caregiver timeout group on Facebook. So I would encourage people that are looking for those caregiver groups. One option is to connect through Facebook, and it's a great chance to meet other caregivers and to see the resources that they put up as well.
Thank you, Danielle. This is another question that came in. My children are now at home due to school closures. I provide full-time support to my husband with Becker muscular dystrophy. I am starting to feel a bit overwhelmed. What should I do? Rebecca, can I invite you to speak on this?
Absolutely. Yes, this is the kind of thing that that is the constant struggle with caregivers, and that is overwhelmed is the feeling that one would get, and that is a cue from your body telling you you need to take some time for yourself. And if that's when everybody's asleep, or if that's trying to maneuver some time when people are napping or occupied or something, so that you can create a moment where you can be on your own and take some deep breaths and do something for self-care for even 15 minutes to half an hour as you can, that overwhelmed feeling will reduce. I mean, it's a lot of work, right? So essentially, there's not much you can do about the workload, but there is something you can do about that feeling of overwhelmedness.
Thank you very much, Rebecca. We also received a question. As a caregiver to someone with neuromuscular disorder, what information should I know during COVID-19 in case of an emergency? Oops, I'm sorry. And so at this time, I wanted to remind you that on our Muscular Dystrophy Canada website, and you might have already received this as part of your clinical care visit, we do have a care and emergency card or an alert card. You can use this information to help guide what information you'd like to share with healthcare professionals should you go into emerge. And so this is something that we've also contacted clinicians across the country in different neuromuscular clinics to say, we're going to encourage our clients and members of our community to fill this out. Will you be able to provide them support in terms of filling out the medical information? And unanimously, everyone has been agreeable to this and is really encouraging you all to go ahead and complete that care and emergency card. Another question that's come in is, should I wear a mask when providing care to my client? This is from a personal support worker. Ken addressed this in terms of that he is not using a mask, nor are his personal care attendants. We also believe and are in line with the Public Health Agency of Canada recommendations, which is frequent hand washing, physical distancing when possible, and using a mask. If you are using a mask, which I know is a recommendation now with the Canadian Support Workers Association, to use the mask correctly. So right now, using a non-surgical mask, if you are using it, then these are the recommendations that the WHO is providing to avoid touching the mask while using it, to use single-use masks one time only, and replacing it with a new one. And when you're removing the mask, to remove it from behind and to discard it immediately. The same applies to using good etiquette when we're using gloves as well. So I am just actually going to check to see if there are questions that are coming in, if I'm not missing any here on our call, and if there are any hand raises. Any other questions?
Humira, I'm not sure if you saw, this is Danielle. We did have one come through the chat, and it says, how do you do self-care when you have to be a night nurse, a cook, a clean, and you have to teach and manage everything else? A lot of what was said sounds easier said than done, and I think it's a great question, and I don't know if, Rebecca, we can turn that to you to maybe help shed some light on all of the things that was listed in the question.
Absolutely. I know this to be true. I myself have been a caregiver, and in a number of different ways. And aspects, including a family caregiver. And I know that it is very hard to find time and to manage everything. And sometimes it feels like, well, if I take time out for myself, then that puts me behind in all the actual work that I have to do in caregiving. And that's, and that is to some extent true. However, if you don't prioritize that, then your caregiving skills are going to diminish, and your ability to actually have satisfaction in what you're doing is going to diminish. That overwhelmed feeling will crop up. So one of the things that I'm going to try to reiterate is just reframing some of the regular jobs, something that you normally would find as a chore. Figure out some way to make it a moment when you can take time out to do it, and do it in a new way. Something like mopping the floor and doing some sort of dance and singing thing to yourself, and then having fun with it. It's a very difficult thing to do, but essentially that actually will alleviate things a little bit more, and you're still getting your work done. So be creative with yourself. Know that you're worth it.
Thank you very much, Rebecca. Are there any other hand raises or questions in the live chat? Well, I am aware that we are a couple of minutes over our time. So to end today's webinar, I would like to encourage us all to take the time today to recognize and thank all the people in our lives who have caregiver roles. I applaud the many caring healthcare professionals and family members for their continued dedication and commitment in these strange and uncertain times. I would also like to thank our speakers for sharing their insights, and to our mission team at Muscular Dystrophy Canada for their ongoing work with supporting caregivers in our neuromuscular community. I would also like to mention that in May, we will be launching a quality of life survey, a study, and there will be one specifically focused on caregivers. So I encourage you all to take that survey. In the meantime, please email us at research@muscle.ca if you have any questions. I hope to see you all next week for our webinar on stress, the brain, and mental health. Thank you all so much for your time and participation.